Hey, it's me. I just finished my interview with the Echo Radio Network. And the story with that is the producers called my office earlier this week. And I checked out their website, which is echoradionetwork.com. And I asked myself, I was like, why would this show want to talk to me? So I called back the producer and was able to talk to them. And they saw my article a few months ago about technology-related illnesses or ailments, not really illnesses. Things like BlackBerry thumb and cell phone elbow and computer vision syndrome, stuff like that. And there's a blog post on it on dranonymous.com. The title is Technology Ailments, so you can read about that. So I said, sure. So that interview just happened within the past hour, and I will share that with you after my little monologue, I guess. But something interesting that I experienced was that when I'm interviewed on television, I only get 2 or 3 minutes. So I've learned to really shorten my answers and really learn to not talk too much. But today's interview was about 10 or 12 minutes, and I didn't really grasp that until about halfway through the interview. They did send me some questions beforehand, and I kind of rolled through almost half the questions in the first 3 minutes. So I'm sure the host was kind of like freaking out, saying, "Why is this guy not talking at all?" We asked you to come on the show to talk, and you're not talking. So about halfway through, I kind of figured things out, and I expanded on my answers a little bit more. But I'll let you to be the judge of that as you listen to the interview. But I want to thank everybody who were able to listen live. And if you weren't able to listen live, that's fine. I will play the entire interview after I finish this video. And don't tell anybody because I'm not sure if it's completely legal that I can rebroadcast this, so don't tell anybody. But thanks again to the Echo Radio Network. You can get there by going to echoradionetwork.com. I was able to listen to some of their past shows. Interesting show. It's once a week, and I encourage you to check that out as well. And now, here's my interview.
Welcome to the Eco Radio Network with Pete Muscanelli on Talk 1300. You know, folks, just about 15 days left before the holiday seasons really kick in. Christmas shopping, 15 days, not a lot of time. Well, on the show, we're going to be talking about a few things that we take for granted. We're talking about the use of cell phones, wireless computer networks, all kinds of radio frequencies out there that we use, all kinds of mobile devices. What kind of problems could we be exposing ourselves to by using these devices? Now, we sort of take them for granted, whether it's your cell phone and you got it up in your hand to your ear for long periods of time. There's problems with that. Well, our guest, Dr. Michael Sevilla, will help us understand the potential long-term consequences of exposure to these electronic devices and how it's impacting our health, both short-term and long-term. Okay, we're back on the Eco Radio Network with Pete Muscanelli. You know, folks, we're talking about all those gadgets our kids are using and the gadgets we use. You know, it's whether it's the cell phone, the BlackBerry, the Droid, so many of them. Let's think about it. You know, you got the GPS systems, you got the wireless computers, you got the laptop computers. We are just so inundated with electronics, and it's got to have some kind of consequence to our health. So on the show with me, I have Dr. Michael Sevilla, who's going to join us and help us understand a little bit about some of the consequences that we're going to have, whether it's how's it affecting our health, and what we can do to maybe consider some options we have. Doctor, welcome to the show.
Good morning, Pete. Good to be with you.
You know, Doctor, first tell the folks a little bit about, thank you for joining us, but tell a little bit about yourself and your area of expertise.
I'm a family physician, primary care doctor here in northeastern Ohio, and always growing up, I've been interested in technology, and it's been interesting to see some of these ailments, some of these illnesses that have come into my office. When it comes to using a lot of these technology.
Let's talk about first moment. Now, we know technology is prevalent in our society. Now, a lot of people are using cell phones and other types of personal electronics. What are the adverse effects from using such technology? What are the most common symptoms you're seeing?
Well, when you're seeing some of these syndromes, you can kind of put them under an umbrella, and you can call it like overuse syndromes. Other terms that can be used are repetitive motion injuries. There's some good information like on webmd.com. I encourage people to check that out too. There's a lot of good information over there. But what happens is when you're doing these overuse, when you're using your fingers, when you're using your elbow, when you're using your arm, what happens is it causes inflammation. And inflammation causes pain. That's why people get a lot of discomfort from this. And the more common terms people may be familiar with are like tendonitis, bursitis. That's what doctors are more familiar with. So those are the things that I see a lot in my office.
Let's take a moment. A lot of folks, I myself, they use Blackberries. The BlackBerry, they use the cell phone elbow. They have that. I actually sometimes, if I'm on a conference call and I'm out of the office and I have to be on the call, and I try to keep it on speakerphone if it's a quiet area, but sometimes I got to hold it up to my ear. Vision syndrome is another one that we talked about. How aware is the medical community of these issues? Like if you present these issues to your own physician, do we need to do more to spread the awareness?
I think physicians and doctors in the medical community, I think they are aware of this. They are becoming more aware of it because they're seeing their patients coming in with these symptoms. In fact, when I go into my exam rooms, sometimes I have people on their cell phones or texting or something like that, and so we're seeing that more and more common. What's interesting is that some of these cutesy type names, they kind of come and go. 40 or 50 years ago, they were using terms like tennis elbow and golfer's elbow. Now they're using cell phone elbow. It's the same type of process. BlackBerry thumb. 20 years ago, they were saying gamer's thumb. With those video games. So the terminology has changed a little bit, but the process and the inflammation and the symptoms that it causes are the same. And when it comes to doctors, I think it wouldn't hurt to educate physicians and the medical community about this. I think we need to know a little bit more about it. But the treatment and the symptoms are fairly the same as they've always been.
Now, we talk about short-term effects. You get some pain and you go and if you're, one of your children and they say, hey, my thumb hurts or something, they play in the game, you could probably tell them to stop. That's a short-term effect. But what's the long-term effects on this? I see some kids are in, even in the shopping mall, they're playing with these games and these, Game Boys and so on. What's the long-term effects? Have there been any studies or, any prediction of where we're going to go with this?
Actually, that's a good question, Pete. I have been reading some studies on this. Actually, the long-term studies we don't know, but some of the things that we have been seeing, eye doctors have been seeing more and more people just with nearsightedness or difficulty seeing far because of things like computers and things. And as you go to the mall, you see these kids with the music turned up loud. We don't know the long-term effects of things like hearing loss. And that type of thing. So it's a good question because one of the interesting pieces of data that I found was that the people using cell phones themselves have doubled in the past 10 years, up to over 285 million people as of 2009. So we don't know, what technology is going to be there 5 years or 10 years from now. So it'll be interesting to see, what evolves through this process.
Now, Doc, you don't mind taking some questions if we can get them in, right?
Oh, that's no problem.
All right. Okay, folks, we'll open up the lines. If you'd like to ask Dr. Michael Sevilla a question, 518-476-1300, 518-476-1300. We've got the lines are open, so you can give us a call if you have a question regarding your cell phones or your children with the Game Boys or so on. One of the things I wanted to ask you, these are ailments are permanent. Are these going to be permanent, or is the damage going to be not be able to be reversed?
I don't think so. I think we're combating this a lot now with education, especially in the workplace with people, using computers. People, may have heard the terms, are ergonomically correct, or, that there are some, what they call adaptive hardware, special keyboards, ergonomic mouse. Those type of things in the workplace that I'm seeing all over now to help combat things like this vision syndrome that we're seeing a lot more as far as getting tired, getting a little bit blurry vision because you're at the computer too long. So I think with education, especially in the past few years, I think we're going to be able to combat this.
Now, there's a question that was posed to me in an email, and it's one of the reasons why I asked Phil and Brian to get you on the show. There's so many folks who are dealing with cell phones and wireless devices. Are you familiar currently of what's going on with how much RF frequency is in the air, and have there been any initiatives by the medical community to start studying that so that these people who keep these headsets are okay, but when they keep their cell phone on and they're gabbing for hours at a time, long-term consequences, anything that you know about that we should let our listeners know about?
I know there's been some studies going on, ever since the beginning of the cell phone, and the question I get all the time is, do cell phones cause cancer? There have been some studies that have said yes. There are some studies that have said no. So I think the bottom line is that we just don't know. We're still studying it, and I think it's a lot of these things with technology is that we're not really sure what the long-term effects are. But as of today, this point, I'm not sure. I don't know.
Folks, if you'd like to ask the doctor a question, you can give us a call, 518-476-1300, 518-476-1300, and we'll try to answer your question regarding a specific concern that you may have regarding some of these electronics devices. You mentioned a couple of the websites, Doctor, regarding where people can find out more information. What other resources can you offer them of how they could recommend maybe a good resource to learn to start getting better familiar with some of the potential ailments or problems that they could have with some of these electronic devices?
What I recommend to my patients a lot is WebMD, and because a lot of that information is written by physicians and read over by physicians, and a lot of that is very good medical information. Questions I also get is, how do we treat this type of thing? There are some medications out there that can treat the pain, like anti-inflammatory type medicines, because the pain comes from inflammation. There's also just some simple stretching exercises that people can do to help loosen up the muscles, loosen up the tendons there, that is natural, that you don't have to take any kind of medication. So I get that question a lot too, as far as what are some good education resources, and how can we treat this? And a lot of these things are very simple and don't require any kind of medicine at all.
If we had a crystal ball, we could look in the future a little bit. We know that these devices are going to continue to dominate our society. No one leaves the home without a cell phone these days. No one leaves the home without or work without being on a computer. I can see our society as they age. We're actually aging slower, but it seems like parts of our body are deteriorating more quickly because of some of the effects of these electronics. I hope that the medical community will start to warrant some more studies on this, because we really need to be able to figure this out before we actually have damage, whether it's in the eyes or, the study that says there is cancer because of cell phones, or there's no cancer. So, I would encourage the medical community to see what they can do about encouraging more studies on this and see exactly whether it's a potential long-term effect on our human health.
Oh yeah, I mean I completely agree with that. There are some studies going on right now as far as what are cell phones, gaming devices. You go into your car now. There's all these electronics in your car now. What could that be causing the system as far as their electrical or radiation or any of that type of stuff. But I completely agree with you. I mean, yeah, I know there's some studies going on right now, and there really hasn't been anything definitive that I've seen. There's been a lot of conflicting things as far as it could cause this, it can't cause that. I'm not sure. But I mean, you bring up a great point that we need to, as a medical community, really keep track of this and make sure to educate our patients when we find out important information.
Well, Doc, I will put you in our query here for getting you back on the show. If you get something that's unique that we want to get out to our listeners, don't ever hesitate to drop me an email. Now, one other thing, have you written any books or any papers? Give yourself a plug, any of that stuff?
No, actually not. I've always have a lot of projects that I've started as far as books and articles and things. But I definitely thank you for the invitation to come on and talk about this, and I'd be happy to come back at any time to share and follow up on this issue with you, Pete.
Well, anytime that you hear any updates, Doc, we're appreciative of you taking the time. We know you're busy. And we'll also put a link up on the website if somebody wants to email you a specific thing, and we'll get you on, at least once or twice a year so we can get updates on this.
Great. Thank you so much for the time.
You have a great holiday season.